1. A 50-year-old man presents in emergency ward with central chest pain. On examination, his blood pressure is 90/60ths of a millimeter of mercury and pulse is 106 per minute. He is pale and sweating profusely. The most likely diagnosis is A. Esophagitis, B. Myocardial infarction, C. Pericarditis, D. Pleural effusion, E. Pneumothorax. Here option B is correct. Myocardial infarction is a condition in which reduced blood flow in a coronary artery due to atherosclerosis and occlusion of artery due to embolus or thrombus. Its clinical manifestation include chest pain, hypertension and hypertension, increased sweating, palpitations, weakness, fatigue, and dyspnea. 2. A 35-year-old man presents in a clinic with history of chronic productive cough that is worse in the morning and brought on by changes in posture. Sputum is copious and yellow. The most likely diagnosis in this patient is A. Bronchial asthma, B. Bronchiectasis, C. Bronchogenic carcinoma, D. Chronic bronchitis, E. Pulmonary tuberculosis. Here option B is correct. Bronchiectasis is a chronic and irreversible dilation of bronchi and bronchioles. The hallmark of bronchiectasis is persistent and recurrent cough that is worsened in morning with production of large amount of sputum which is copious and yellow. Clubbing of finger also seen because respiratory insufficiency. 3. A 20-year-old girl is taking anti-tuberculosis treatment. She presents in outdoor with visual complaints. The most likely cause of her symptoms is side effect of A. Isoniazid, B. Rifampicin, C. Etambutol, D. Pyrazinamide, E. Streptomycin. Option C is correct. Because the side effects of etambutol are optic neuritis, colors blindness, allergic reaction and hyperuricemia, while isoniazid, rifampicin, pyrazinamide cause hepatotoxicity while streptomycin cause vestibular dysfunction, deafness, peripheral neuritis, and neuromuscular blockage. 4. A 15-year-old boy who is diabetic presents with pain abdomen, vomiting and shortness of breath. There is history of fever and sore throat 2 days back. The most likely cause of his symptoms is A. Diabetic ketoacidosis, B. Gastritis, C. Hyperglycemia, D. Non-ketotic hyperosmolar coma, E. Renal failure. Option A is correct. Diabetic ketoacidosis. 5. A 40-year-old lady gives history of weight gain and hoarseness of voice. On examination, her pulse is 64 per minute and skin is pale, coarse and dry. The most important investigation to find diagnosis in this case is A. Adrenocorticotrophin hormone, ACTH, B. Cortisol level, C. Gonadotrophin levels, D. Insulin-like growth factor, IGF, E. Thyroid function test. Option E is correct, thyroid function test. 6. A 10-year-old boy gives history of swelling of body starting from face and more on getting up in the morning. On examination, his blood pressure is normal, pallor is absent and jugular venous pressure is not raised. Signs of ascites and bilateral pleural effusion are found. The first line of investigation in this case is A. Blood urea level, B. Chest X-ray, C. Echocardiography, D. Liver function test, E. Urine for albumin. Option E is correct, urine for albumin. 7. A young girl comes in the cardiology ward with history of breathlessness and palpitations for last 1 year. After auscultation of precordium, cardiology registrar makes diagnosis of mitral stenosis. The most important sign on which this diagnosis is based is A. Ejection systolic murmur, B. Mid-diastolic murmur, C. Mid-systolic click, D. Pan-systolic murmur, E. Third heart sound. Option B is correct, mid-diastolic murmur. 8. A 15-year-old boy presents with history of fever and arthritis. There is past history of similar symptoms 1 year back. A diagnosis rheumatic fever is made. The treatment of choice for this patient's symptom is A. Aspirin, B. Diclofenac, C. Ibuprofen, D. Paracetamol. E. Morphine. Option A is correct. Aspirin. 9. An old lady presents with history of fever and left-sided chest pain for 1 month. Examination of respiratory system shows decreased chest movements, stony dull percussion note and absent breath sounds on left side. Her chest X-ray is likely to reveal A. Collapse. B. Consolidation. C. Fibrosis. D. Pleural effusion. E. Pneumothorax. Option D is correct. Pleural effusion. 10. A 40-year-old woman gives history of fever for last 3 weeks accompanied by dry cough, night sweats and weight loss. Chest examination is normal. Abdominal examination reveals hepatosplenomegaly. Chest X-ray shows symmetrically distributed fine nodules. The most likely diagnosis is A. Military tuberculosis. B. Chronic liver disease. C. Malaria. D. Pneumonia. E. Typhoid. Option A is correct. Military tuberculosis. 11. A young girl complains of nocturnal cough and shortness of breath which disturbs her sleep. A diagnosis of bronchial asthma is made. The most important investigation to confirm this diagnosis is A. Chest X-ray. B. Eosinophil count. C. Lung function tests. D. Ceramic levels. E. Sputum examination. Option C is correct, lung function tests. 12. A 40-year-old man presents with cold intolerance and weight gain. Examination reveals goiter. The most likely finding on central nervous system examination is A. Ataxia. B. Delayed relaxation of ankle jerk. C. Hypotonia. D. Hyperreflexia. E. Loss of sensations. Option B is correct, delayed relaxation of ankle jerk. 13. A 15-year-old girl presents with history of fever, bleeding from gums and pallor for last 15 days. Her peripheral blood film shows pancytopenia. The most important investigation is A. Bone marrow examination. B. Coombs test. C. Reticulocyte count. D. Serum folic acid level. E. Serum iron level. Option A is correct. Bone marrow examination. 14. Which of the following drugs is used in the treatment of hyperkalemia in acute renal failure? A. Amiloride. B. Amlodipine. C. Captopril. D. Insulin. E. Propranolol. Option D is correct, insulin. 15. For the patient with history of fever, headache and neck stiffness, the most important investigation is A. Cerebrospinal fluid examination. B. Complete blood counts. C. Computerized tomography scan brain. D. Magnetic resonance imaging brain. E. X-ray skull. Option A is correct. Cerebrospinal fluid examination. 16. The most common risk factor for chronic obstructive pulmonary disease is A. Air pollution. B. Coal mining. C. Infection. D. Low socioeconomic status. E. Tobacco smoke. Option E is correct. Tobacco smoke. 17. In a patient with centripetal obesity, acne and hirsutism, the most likely diagnosis is A. Cushing's syndrome. B. Diabetes mellitus. C. Hypogonadism. D. Hypothyroidism. E. Simple obesity. Option A is correct. Cushing's syndrome. 18. In a young boy with hypertension, examination of cardiovascular system reveals radiofemoral delay. The most likely cause of hypertension in this patient is A. Coarctation of aorta. B. Diabetic nephropathy. C. Connecticut's syndrome. D. Dissection of aorta. E. Renal artery stenosis. Option A is correct. Coarctation of aorta. 19. The gait of a patient with cogwheel rigidity and pill-rolling tremors is likely to be A. Drunken. B. Hemiplegic. C. High-stepping. D. Normal. E. Shuffling. Option E is correct. Shuffling. 20. An old patient presented in emergency ward with history of weakness of right side of body of rapid onset. The most helpful first-line investigation for management of this patient is A. Cerebral angiography, B. Cerebrospinal fluid examination, C. Computerized tomography scan brain, D. Fasting lipid profile, E. Nerve conduction study. Last question is your homework. Comment your answer. And don't forget to like, share, and subscribe MCQ Practice channel.